First, I also wanted to address the actual day we find ourselves here today and the steps we'll be taking going forward. We're going to continue to remain in stage 4.5 on our Back on Track plan. We're going to continue with the mask mandates statewide for another 30 days. We're on one hand, we're pleased that we've been holding steady, kind of steady Eddie, Indiana here in terms of our positivity rate. We don't want that to trend up. We'd like to see it start to trend down even more so. But again, Dr. Box will go into everything that is factored into how we arrived at this decision, all the different input that goes into it. So with that, Dr. Box, if you would, please.
Thanks, Governor Holcomb. Good afternoon, Hoosiers. Today we reported 971 additional cases of COVID-19 in Indiana, which brings our total to 89,359 total Hoosiers known to have COVID. We also saw 18 additional confirmed deaths. To date, 3,041 Hoosiers have died of COVID-19, and another 218 are believed to have died from this disease based on their clinical diagnosis. Currently, nearly 37% of ICU beds and more than 83% of ventilators are still available. About 12% of occupied ICU beds are housing patients who either have been diagnosed with COVID or have symptoms of COVID. Less than 3% of ventilators are being used by someone who has COVID or is suspected of having it. We also have seen more than 1 million Hoosiers tested for COVID-19, up from more than 934,000 a week ago. We also continue to look at the data that provide the foundation for our decision-making as part of our 4 guiding principles. One is the hospitalization rate. As of August 24th, 987 Hoosiers were hospitalized for COVID or with COVID-like symptoms. That's still well above our 595 in late June. We saw 90 patients admitted on August 20th, which is slightly higher than what we saw in late July. Our 7-day positivity rate for unique individuals tested was 6.6 as of August the 18th. When you look at all tests administered, the rate drops to 5.4%. As I mentioned last week, we are now calculating both rates to better compare ourselves to other states that are using total number tested and not just unique individuals. In addition, we began including antigen tests in our daily dashboard on Monday, because these tests are more widely used. We added these antigen tests because the method has become widely available and accepted by the CDC. Adding these antigen tests has not significantly increased our cumulative positivity rate throughout this pandemic. The cumulative rate stood at 8.8% on Sunday before we added in the antigen test and dropped to 8.7% with the addition of those antigen tests. We also continue to evaluate the data from our partners at Regenstrief. To date, they have looked at 85,462 cases. Of those, about 21% visited the emergency department, which is down slightly from last week. A total of 10,417 were hospitalized, which represents 12% of all positive cases. That is the same rate as the week before. Of those who were hospitalized, 20% were admitted to the ICU, which is down slightly from last week. That represents 2% of all positive patients, which is also a decrease. 75% of hospitalized patients have been discharged, which is a slight decrease. Of the remaining 25%, 7% are believed to still be hospitalized, 18% are known to have died while hospitalized. Regenstrief estimates that 79% of patients have recovered, which is an increase from last week. While we've been able to maintain stable ICU and ventilator capacity, our hospitalization numbers continue to fluctuate and run higher than what we saw in June, as I mentioned earlier. Another one of the principles to reopening our state is our ability to conduct contact tracing for individuals who are positive and their close contacts. We started with 500 contact tracers in May and currently have 680 employed at the centralized state contact tracing operation. When you add the nearly 300 local health department contact tracers currently in place and another 300 that Marion County plans to hire, that brings the statewide contact tracing workforce to more than 1,200 people. Since May, our state contact tracers have handled more than 352,000 calls and sent nearly 437,000 texts. More than 76% of these contacts have been successful, which means that we were able to connect and complete an interview. This rate is well above the 50% rate that we are seeing nationally, but it still indicates that about a fourth of the people who need contact tracing are not responding. We know that some people aren't willing to answer a call or reply to a text from an unfamiliar number and we are working to build awareness of the numbers that the texts and phone calls come from. So if you get a text or a phone call from the State Department of Health about an important public health matter, please answer the text, answer the call. All of these metrics are important as we look at where we are as a state and how to most safely bring people back to work and to school. Many school districts and local officials have asked for metrics to help them better understand what's happening in their communities so that they can make better operational decisions. We've developed a new color-coded map that evaluates each county's status based on 3 key metrics. Those are the number of new cases per 100,000 residents in the past week, the percent positivity as determined by the number of positive tests divided by the number of administered tests, and the change in the percent positivity from the previous week. The goal is to provide an easy-to-understand system that local and school officials can use to inform their decisions. I want to emphasize that this score does not trigger a requirement of action, but it provides information and recommendations. Each metric will be assigned a score of 0 to 3. The average of the 3 scores will be the county's total score for the week. Our first metric is our new cases per 100,000 residents. Less than 10 new cases will be assigned a score of 0. 10 to 99 new cases will receive a score of 1. 100 to 199 new cases will score a 2. 200 or more new cases will receive a score of 3. Our second metric is for percent positivity. If you have less than 5%, you will receive a 0. A rate of 5 to 9.9% will receive a score of 1. 10% to 14.9% will receive a 2, and greater than 15%, or 15% or greater, will receive a score of 3. Our third metric then will be looking at the change in percent positivity from the previous week to the current week. A decrease of 0.5% or greater will receive a score of 0. A decrease of less than 0.5% to 0 will equal 1. An increase of 0.1% to 0.4% will get a score of 2, and an increase of 0.5% or more will receive a 3. Once we have the average of those scores, we will place the county into one of 4 colors. Blue will be 0 to 0.9, yellow 1 to 1.9, orange 2 to 2.5, and red greater than 2.5. And you can see now how this looks on the map. Each color category comes with recommendations for school and school officials to consider based on what the metrics show regarding their community spread. Blue indicates minimal community spread. The recommendations would be that schools operate all grades in person, but limit activities where social distancing is not feasible. Extracurricular activities should follow state and local guidelines, including distancing and masks, and limit spectators. Outreach occurs to encourage, at this time, public to continue with their precautions. Yellow indicates there's a moderate community spread. The recommendations to consider here would be that schools continue all grades in person, but have increased vigilance with the social distancing, hand hygiene, and use of masks. There should be no assemblies or activities that occur if social distancing is not feasible. Schools should postpone or consider canceling extracurricular activities as warranted, and consider allowing parents or close family to be the only attendees at athletic events. And we should consider that it's important to work with the local health departments to determine if increased precautions and public outreach should begin to halt further spread. A county in orange would be experiencing moderate to high community spread. In this case, the recommendations include grade schools continue in person and that a hybrid learning approach be considered for middle and high school students. Consider having no assemblies or large group activities. Consider extracurricular activities are limited and have maybe just the competitors and the participants only with no in-person attendees. We would also recommend that schools have discussions with their parents about limiting social events outside of school. We continue to see many of our cases associated with sleepovers and parties outside of school, but with school friends. We also recommend that county education leaders work with their local health department to consider implementing aggressive prevention efforts in schools and communities. Red counties are experiencing high community spread. For these counties, the recommendations to consider are that grade schools could remain in person, or you could consider hybrid if you can't social distance without that. And middle schools and high schools should consider virtual learning. No assemblies or large group activities should be considered or held. You should consider canceling extracurricular activities, and we would discourage social events. We would also again encourage county education leaders to work with their local health departments to consider implementing aggressive prevention efforts in schools and communities. All school systems are asked to make every effort to keep one school building open, even during high community spread, so that we can assist those students who need remote learning, who need to be ensured of a safe environment, and to provide food security. To better understand how this all comes together, let me show you a couple of counties. First, let's look at Daviess County, which is in the red and has an average score of 3. This score is based off of 243 new cases per 100,000 individuals in this past week. Also, their current positivity rate was 18.4%, and that was again total test over total test administered. They had an increase in their percent positivity of 9.3%. All three of these metrics earned a score of 3. So if you add those together and divide them by 3, that's how you come up with 3, which places them in red. Now, our State Department of Health has been working with our local health officers and local health departments in both Daviess and Martin County because both of them appear in red. We know that in Daviess County that there was a large outbreak in a church there that had to be closed, and that there are several businesses that have many cases that they are also working with. We know that these individuals have asked for more testing, and so the State Department of Health will actually be there on Thursday or Friday this week from 8 a.m. until 6 p.m., and we'll be running a drive-through testing there for all individuals. The site chosen is in Daviess County, but it's very close to the Martin County line. I also want to talk about Adams County, which has been very successful. They had been in orange and red due to an outbreak there associated with an establishment that had to be closed and the need to reaffirm the wearing of masks in their county. But now their situation is improving and they are in blue with a score of 0.7. That score reflects 53 new positive cases, which earned a score of 1, a current positivity rate of 8.1%, which also scored a 1, and a significant decline in their positivity rate, which received a score of 0. What I want to emphasize is that these metrics change. A county that's in red today won't necessarily stay there if people take the right steps and contact tracing is successful. And a county that is in blue today can easily change colors if people ignore social distancing, refuse to wear their masks, and continue to go to work or school if they're symptomatic or close contacts. The best way to get counties into blue and to keep them there is for every Hoosier to make the choice to protect others. Thank you.